Thank you, Tonya. Thank you very much. And it's really nice to be here. I'm sorry we're not meeting face to face this year, but it's nice to connect with people anyway. So Tonya, thank you for these slides. If I perhaps if I make a start with these slides, and then Shella, I'll hand over to you as well, or we can do it as we go through. Let's see. So the beginning of this is just to give some background. At the start of the pandemic last year, our National Health Service commissioners, Bernie Stocks and others who commissioned the service on behalf of the health service, had the opportunity to apply for some extra funds to support families and patients during COVID, particularly when clinics were being cancelled face to face. And it was really trying to help people to monitor their own health and keep healthy during those times. But I think we then realised that actually it could be really helpful going forward anyway, even when clinics do start face to face again as well. We started by thinking what were the most important things likely to be for families here, and we thought of blood pressure because some families have at risk or have issues with kidney problems, and blood pressure is a good measure of that, and it's something relatively straightforward to be able to do at home. And then we thought of weighing scales because, at least in some children's practice, some people, but not all, have a predisposition because of the condition to gain weight. And part of the management is to try and support people to maintain a healthy weight. So the scales would be healthy to work with their dietitians to do that. And then we thought we perhaps need talking scales because, of course, of the vision issues as well. So we have to be selective on those. Tape measures potentially relevant for a stadiometer is the name for a height measure to try and accurately measure people. So we chose stadiometers to try and help measure height, because some young people they can have growth issues. And then we chose a finger prick blood testing kit because we know it's important to do blood tests as an annual review, but it can be actually quite difficult to get to hospitals, and particularly in pandemic times, that can be tricky. So we managed to find a service in the National Health Service that could do most of the annual review tests on a finger prick, so not needing nearly so much blood, and could be done at home. So that's why we chose those. And we did it really to support some of the clinics that had already started before COVID, being telemedicine clinics, but then to support all the other ones that moved to remote monitoring during COVID. But most importantly, as we go back to face-to-face clinics, these kits still may be helpful to help people between their clinic visits, and perhaps we can offer an extended service or a better service because of this. Right, I'm going to try moving slides. So I've moved on to equipment instructions. Can you see that? Tonya, Sheila, can you see this slide? Right.
Yeah, it's moved on fine, Tim. Thank you.
Oh, fantastic. Okay, so these slides are really just to show a bit about the equipment that we've got, and a bit of basic information about how to get started with them. So the blood pressure one, it comes in a box with a set of instructions. So if your carer or parent are there, can help to set this up. And it's an ordinary blood pressure cuff that you put up the top half of your arm, preferably on the right arm if possible, and above the elbow. And it's got tubes which you use to pump it up, but the tube should be running down the center of the forearm on the inside of the arm. The result is then shown on the monitor when you press it on, and we'll need somebody to be able to read that monitor, because we couldn't get a talking blood pressure machine to do that. But the machine will also store the blood pressure readings. So the best time to do it is going to be when you're the most relaxed. So perhaps first thing in the morning when you're still in bed would be a good time, or maybe last thing at night as you're going to bed when you're feeling quite relaxed as well. And there is some instructions that comes with it to show that. And then the weight scales, like all weighing scales, these are basically bathroom scales, and you put them in your bathroom or on a flat surface, and they should talk and say hello and then read your weight when you stand on them. So you can then record the results somewhere, because they don't store the data. And then if the BBS nurse or anybody else is asking for them, then you've got an up-to-date weight to give them. And again, the usual recommendations are, don't weigh every day, only weigh, if you're going to do it, perhaps once a week is quite enough. And always try and weigh at the same time of day. Again, often first thing in the morning, and always try and weigh wearing the same clothing, so that doesn't affect the weight, and no shoes, just socks, so that those don't interfere with the weight measure. And then the tape measure is really particularly for adults for measuring waist circumference, and it's a specially designed one. It's got sort of metal circles or metal rivets which you can feel every inch. And then at the beginning of the tape, there's a piece of metal so you can feel the end of it. And the end of the tape has got 2 large rivets to it. But importantly, as you put the tape around your middle, try and put it round so that it touches your tummy button. It goes through your tummy button. And then you can feel the rivets every inch to count how many inches it goes around, you can see. So you should be able to measure your waist counting the number of rivets. And every 12 inches, there are 2 rivets together. So that helps you keep count. So you could do it in sort of feet and inches. So we were very old-fashioned measures here. The Stadiometer, as I said, is just a measure for children's services, and it's a height measure. And this can be set up on a flat surface and ideally against a wall. And it's asking your child to stand shoes and socks off with the heels against the back of the Stadiometer and the bottom and the upper back against it. And standing nice and straight and looking straight ahead and standing flat on their feet. And then there's a measuring arm which you can bring down until it gets to the top of your child's head. And then you can record at eye level what that measurement is on the side of the Stadiometer. So it's just a bit more accurate than measuring up against the door frame you would do. And then finally, the home blood sample kits. So these are something new that we've not tried before, and we hope it's going to work okay for families. We have, these are used for patients under the care of Exeter Hospital, and they send you a pack to your home by post with instructions in them as well, and a finger prick testing. So if you know somebody with diabetes, you'll know about how the finger prick testing works with that. There's a little finger prick lancet. And these are tiny blood bottles, much smaller than usual, collecting a much smaller volume of blood. So it's well less than a teaspoonful. And having pricked the finger, you then squeeze the blood sample into the little bottle until it goes up to the fill line. It's not very much, thankfully. And then you post it all back to the lab in the envelope which comes with the kit. So it's free post, you don't have to pay for it. And then there is a video which has been produced which can show people how that can be collected and samples done. So that's where we go. And then this is just the results, just to say that with the telemedicine appointments, we'll ask you to weigh and measure yourself and blood pressure before the appointment, and hopefully to do the blood testing kit as well. What the blood testing kit measures is ordinary things like, are you anemic? Is the blood count okay? Is the kidney function okay? Is the thyroid function okay? And what's the glucose level doing? And I think we have vitamin D in there as well. So really common, simple things that are helpful for everybody to help look after. And then we're discussing with Kath and the other specialist nurses how often it would be helpful to do these. But we'll obviously let you know, and it'll be different for different clinics and different populations. But the most importantly, this is there to hopefully, which will be of some help to people and some reassurance that we can try and monitor health with you between clinic appointments, whatever happens with face-to-face or remote ones. Okay, I think that was all about the equipment. Shella, before we go on to the individual ones, was there anything you wanted to add about the equipment as I've described it?
No, that's fine. Thank you. I guess the only thing to add is that the blood tests, if I recall correctly from our discussion with Exeter and the Commissioner's team, was really for children above the age of 1. So we're not doing babies.
Yes, that's a very good point. Yes, yeah. we're not including babies in that. Yeah.
Tim, would it be helpful for me to show the short clip of the blood test?
Yeah, sure.
Yes, please do.
We can have a go. I'm not sure how successful this will be, but let's give it a go.
Of course.
The blood collection process can take some time, so make sure you do not have to rush this procedure. Preparation. You need to be well hydrated, so drink a glass of water 10 to 15 minutes before you collect your blood. Make sure your room is comfortably warm. You may have more than one tube to fill depending on the test you have ordered. Open the lid of the clamshell packaging and remove the tube. Close the clamshell and place the tube upright in the circular recess near the edge. Soak your hands in hot water or wash for 2 minutes and dry your hands thoroughly. This will get the blood flowing and makes collection easier. Blood collection. Collecting your sample. Choose the finger from which you plan to collect blood from. We recommend you try your little finger first. If you are able to, stand up and stay standing throughout the blood collection procedure. Twist off the blue cap of the lancet. Place the lancet firmly against the outside of the pad of your finger. Apply increasing pressure until you hear a click. You will feel a small scratch. Massage the side of your hand from your wrist down your finger towards the tip to encourage blood flow. As the blood drops form, gently touch them on the inside edge of the tube to collect them. Fill the tube to the recommended level. Your test may only require 1 tube. If you fail to collect enough blood from your selected finger, repeat the process on a different finger using the spare lancet. Continue to fill into the same tube. After blood collection, securely replace the lid and gently invert the tube several times, returning your sample. Place the tube or tubes back into the plastic clamshell and firmly close the 2 sides together. Fill in the day's date on the form and tear off along the perforations. Pack the clamshell with the completed form into the prepaid envelope and seal. Please post the same day.
Great, thank you. Well done, Tonya. That worked really well. That's fantastic. Great. That's brilliant. That's really good. Right, I'll just find the last of the slides that I was showing again. Just bear with me. Right, let's just share this again. Yes. There we go. Okay, so this system is already being used within the National Health Service for other groups of patients, and we thought it could be really helpful for BBS families because it might save a trip to the doctors or save a trip to the hospital to do that. So we'd be really keen to hear, as these get rolled out, your feedback about how useful it was or how successful it was from that. But I think potentially it could be a really helpful addition to the service for groups of patients. Okay, so just a quick update from the Birmingham end. At the Children's Hospital, the equipment has been sent out. And we had a clinic on a multidisciplinary team clinic on Monday, and it was really nice because the families have said yes, the equipment's arrived. The clinic we did on Monday, it had to be a remote clinic, unfortunately, although we're going back to face for others. But as a remote clinic, because the families had had the equipment, they were able to tell us the heights and the weights and the blood pressures of their children, and that was really helpful because we could make it a much more meaningful and productive clinic from it. Now, for that clinic, we're sending out the first blood packs from the Children's Hospital over the next week, and we'll get feedback from that clinic about how people got on. And hopefully we can then share that with the rest of the BBS community via the newsletter and via Tonya as well. As I understand it from the Queen Elizabeth Hospital, they've now got all the equipment and it'll be being posted out to adults with BBS over the next 2 or 3 weeks, so that it'll be available for adults attending the telemedicine clinics that are there. So that's mine. Sheila, did you want to update about the London sites?
I will. Thank you very much, Tim. Thank you to Tonya and to you, Tim, for setting the scene so nicely. So for those of you who don't know me, I'm Dr. Sheila Mohammed. I'm the clinical lead for the transition service at St Thomas's and the adult service. And I'm very ably supported by the A team, that is BBS UK, particularly Angela, Kath, who unfortunately can't be here today, and obviously all members of the team that work across Great Ormond Street and Guy's and St Thomas's. So I'm just going to give a brief update of where we are with equipment and the process that Tim has very kindly outlined. So for St Thomas's, we have all the equipment, and as of next week, we will be sending out the equipment in batches, obviously prioritized for those patients who are coming up to see us for the telemedicine clinic. We are running our face-to-face clinics where Kat sort of helps with all the blood sampling and the assessments. But you will be receiving the packs in the post by courier. So it will have all the instructions that Tim has very kindly agreed to share across the 4 services. So all the slides that Tim has seen, I think, Tonya, are probably already available or will be available through the BBS UK website. But we have magically converted these to a small Word document. So the instructions are there as Tim has talked through, and it will also have the contact details. So what we would suggest is, if you have any queries or concerns, it's probably best to contact your local teams, which would be Kath, Angela, or myself, and we'll do our best to answer any queries. But as Tim explained, the equipment is very simple to use. The blood pressure cuffs are age appropriate, and we would ask you to make a record of the measurements that you take and report back to us, probably about sort of 4 monthly, but the details will follow with the instructions. So I think it'll hopefully be very helpful, not only to complement the telemedicine service, but for those situations where individuals with BBS have difficulty perhaps accessing local services for testing and assessment. So just to give you some feedback from Great Ormond Street, similarly, the process is firmly in hand, and you will be receiving, parents will be receiving the packs along with all the instructions. And as I alluded to earlier, the blood testing kits will also be sort of sent out to you, but will be for all the children, I guess about the age of 1, because it's just simpler to avoid having to bleed babies under the age of a year. So hopefully having a system across all 4 sites will be really helpful for us to enhance the level of service that we offer. And I think I'd particularly like to sort of thank NHS England and our commissioners who commissioned the service for the support that they have offered us through COVID, and their ability to amazingly have found funds that will hopefully complement the service even further in the years to come. So I think that's all I had to say, unless Tonya or Angela, I'd overlooked anything from your perspective.
No, I think that's covered it nicely. Thank you both.
Okay.
That's fine, Shella.
Thank you very much. Thank you.
And just to echo what you've said, we are extremely grateful to NHS England for the funding, but also to all 4 centres for the considerable work that's going into getting this scheme off the ground. It's not insignificant, but it is going to make a hugely significant difference to our community. So thank you all for that.